Dementia Researcher with a blog and a rating.
What is mixed methods research and how do you go about it? In health and social care, we often think about research methodology in one of two ways, qualitative or quantitative. But what if we use both? Mixed methods research involves both quantitative and qualitative research methodologies. So, on a quantitative side, this can involve big data analysis using existing databases such as the ELSA or the SAIL databank, conducting questionnaires or surveys. These are just examples. On a qualitative side, this can involve interviews or focus groups. Specifically, there are 4 types of mixed methods design. First, explanatory sequential. Quantitative data are collected first, and then are followed by qualitative data collection to try and explain the quantitative findings. Second, exploratory sequential. Qualitative data collection is followed by quantitative data collection to test findings. Third, parallel, when you collect data for both studies at the same time. And fourth, nested. This can have either a qualitative or quantitative approach as a key focus, with the other approach answering a side question which is nested into the main approach. The aim and benefit of mixed methods research is that you can explore one topic, say health inequalities in dementia, from different angles. This can be particularly useful when there is little known about a topic area. Indeed, mixed methods research is becoming ever more prominent in health research as it allows exploring and understanding complex issues which just often cannot be answered by only taking one approach. Let's take the example of inequalities in dementia care. If we just look at whether there are any inequalities, what is the benefit of this knowledge? It would probably leave far more questions than answers. But if we just spoke to people about whether they experience any barriers to care, we would not know the scale of the problem. So you can see how both angles and approaches complement one another. And that's precisely what we've done in a recent cross-country study between England and the Netherlands, funded by the Alzheimer Society. We took a parallel mixed methods approach by conducting a survey for unpaid dementia carers and semi-structured interviews with unpaid carers and people living with dementia. The aim of this study was to explore inequalities in accessing and using post-diagnostic dementia care and how these might vary between England and the Netherlands. Together with a consultation group of healthcare professionals and 2 carers and 1 person living with dementia, I co-produced the carer survey and I co-produced the interview topic guide with the carers and person with dementia. Both the survey and the topic guide were then culturally adapted and translated into Dutch. We found that carers and people with dementia experience too many barriers in accessing and using care in both countries, with some barriers including lack of finances, lack of awareness, and lack of trust into existing services. However, one key facilitator which emerged was dementia care navigators. These appeared to be much better integrated in the Netherlands, enabling carers and people with dementia to navigate the maze of dementia care much easier and be signposted to vital care. In England, though, dementia care navigators were sparse and often failed to provide the same effect. Whilst mixed methods research is not suitable for addressing all types of research questions, it can certainly provide a very complex approach, enabling answering a research question better and more nuanced. So next time you think of conducting a specific research project, a mixed methods approach might be worth thinking about.
Thank you for listening. Join the Dementia Research bloggers and share your own views.